friends, this is Pratyusha. Thank you for subscribing my channel. Today we want to discuss interactions of digitalis. I already explained about the mechanism and what are the cardiac glycosides and what is the pharmacokinetics of digitalis. Now, today onwards, I will explain a little bit topic about the digitalis interactions of digitalis. Actually, here the digitalis interacts with various drugs. What are the drugs? Let us know. These digitalis interacts with diuretics. When digitalis interacts with diuretics, there is a increase erythemiasis. There is increase erythemiasis because of these diuretics. These diuretics, because it promotes into hypokalemia, because of these increase there is a erythemiasis. This is the first interaction. When the digitalis interacts with diuretics, there is a increase erythemiasis. There is a increase erythemiasis means because it promotes into hypokalemia. That's why increasing the erythemiasis. This is the first interaction of this digitalis with diuretics. When the digitalis interacts with the particular calcium, synergism is there. Synergism with digitalis. These calcium, the drug digitalis interacts with this calcium. Synergism with digitalis is there. That's why increasing the toxicity. This particular drug digitalis increases the toxicity. This is the second interaction. What is the third interaction? Here the quinidine. The particular drug digitalis is interacted with quinidine drug. It decreases the binding of digoxin proteins. Because of this decreasing the binding of digoxin proteins, so there is increase in plasma digoxin level. That's why maybe there is increase in plasma digoxin levels, increases the toxicity. It increases the toxicity. That's why we don't give the digitalis with quinidine. This is the reason why we don't give the digitalis with quinidine. This is the third interaction of digitalis. Coming to adrenergic drugs. Adrenergic drugs, if adrenergic drugs are used in patients, on digitalis, it may result to erythemiasis. So if the patient is using digitalis and if you want to administer the local anesthesia to such patients, you can give the plain lidocaine is used. Are you understand what I am saying here? Just if adrenergic drugs are used in patients on digitalis, it may result to erythemiasis. So if the patient is using digitalis and if you want to administer the local anesthesia to such patients, plain lidocaine is used. If adrenaline is mixed with lidocaine, and it may result into erythemiasis. That's why adrenaline is mixed with lidocaine, then it may result into erythemiasis. This is the interaction of adrenergic drugs with digitalis. Now coming to the propranolol, verapamil and dialtiazem. On patients with digitalis, it depresses the AV conduction. When we are giving these digitalis with propranolol, verapamil, dialtiazem drugs on patients, it depresses AV conduction. These are the some of the interactions of digitalis. It's a very important topic in the examination point of view of medical students who are studying the MBBS, nursing, pharmacy, paramedical, pharmacy. These are the students which are to know. This is a very important topic. It's these or the cardiac glycosides, very small topic. I just explained the few important points of the cardiac glycosides interactions. And coming to the uses of cardiac glycosides means the uses, particular uses of digitalis. What is the main use of this digitalis means it increases the myocardial contractility. That's why in congestive heart failure, it cases in some congestive heart failure cases, when the heart function begins to fail, increasing myocardium is very needed. That's why it's a very useful in congestive heart failure. In such cases, digitalis is upgrade to use. It's a very important drug to use in such cases. Then in patients with cardiac arrhythmias, it's a very useful drug in cardiac arrhythmias also, such as arterial fibrillation, arterial flutter, and PSVT. What is a PSVT means? Paroxysmal supraventricular tachycardia. In such patients, digitalis improves the condition of that particular patients. This is the uses. It is used in congestive heart failure, cardiac arrhythmias. In cardiac arrhythmias means such as arterial fibrillation, arterial flutter, and PSVT. It's a very important drug to use in emergency or clinical practices. This is a drug very important for functioning of the heart and strengthening the heart and increasing the, first of all, it increasing mainly, what is the uses means it increasing the myocardial contractility. That's the point overall. This is about the simple topic about the cardiac glycosides. I'm explaining what are the cardiac glycosides, what is the mechanism of cardiac glycosides. Day before day, I already explained the pharmacokinetics of digitalis, and now I am explaining the interactions and uses of the particular digitalis drug. This is a very simple topic. And tomorrow and day after tomorrow, we can discuss about the congestive heart failure. What is a congestive heart failure? What is the treatment of this congestive heart failure? Thank you so much. Please subscribe my channel, like and share my channel. Thank you for watching. Please subscribe my channel.